To Health Matters now. Nurses at the University College Hospital, Ibadan, have joined the ongoing nationwide strike declared by the National Association of Nigerian Nurses and Midwives, following the expiration of a 15-day ultimatum issued to the federal government. The strike, which commenced on the 29th of July, has paralyzed services across public health institutions as nurses demand urgent attention to long-standing welfare and professional issues. Speaking with journalists after a closed-door meeting at UCH, the chairperson of NAN-UCH chapter, Funmilayo Faminu, said the decision to fully comply with the national directive was unanimous.
Sadly, we are so concerned about our patients because we do not intend to leave our patients there on the ward stranded without our care. Nurses provide compassionate, competent care across all settings. It is rather sad that we had to recourse to this, but we have no choice, and we appeal to our patients, our clients, that this is a just cause that we are fighting for. Nurses are the only ones that are embarking on this strike, so there are other healthcare professionals on ground to attend to any emergency.
For more on this development, let's speak with the chairperson of the National Association of Nigerian Nurses and Midwives, UCH Ibadan chapter, Funmilayo Faminu. Good to have you join us on TVC Media News. Tell us the basis for this strike by Nigerian nurses.
Thank you.
Yeah, please talk to us about the basis of this strike that you've embarked upon.
The demands. The basis. Can you hear me?
I said yes, please, I can hear you.
For this strike is that the basis for this strike, our demands are as follows. We want the federal government to employ more nurses, as there had been a mass exodus over the few months. Nurses have left the country. We also want the federal government to provide all the facilities that we need within the hospital to care for our patients. We demand also that there should be inclusion of nurses in policy making within the health sector. We would also like that there should be the directorate cadre at the Federal Ministry of Health.
And it's day 2 of the strike. What exactly is your association hearing so far from government with regard to these demands you've listed?
Okay, there was a meeting yesterday which ended in deadlock, and we are still waiting on the national headquarters to give us a feedback that the federal government had engaged them in another round of dialogue. So we are waiting.
So this strike, this strike that's on now, is it actually a total shutdown, or are you making exception for emergencies?
Well, this is a total shutdown because we want our voices to be heard. We want every Nigerian nurse to be allowed to express our demands to the government by embarking on the strike. You know, in addition to all of those demands, we also seek that there shall be centralization of internship for our graduate nurses. So we have all these demands are valid, and we hope that the federal government will accede to our demands as soon as possible.
But does it bother you that there could be hundreds and thousands of people who need help at this time, and for who the nurses play a very crucial role? Here you also have midwives. Talk about the thousands of people who might just want to give birth and need your very dear services. How do you feel realizing that at this time you're not there to help them?
Yes, we are not there to help them, but it is not our fault. We do not desire that we will leave our patients unattended to on the wards. Nurses provide compassionate care. Our care is solely patient-centered. Unfortunately, we have to do this to express ourselves because nurses have been neglected for far too long. One of our demands also is the gazetting of the circular by the NCA, which had been done since 2016. You will see that this is taking far too long. We also want that the NIC judgment of July 2012 should be implemented. These are taking far too long, and we also want our patients to be our voice at this time, to let the government know that nurses have been neglected. We are suffering from burnout. We are tired. We want our voices to be heard. And it is so sad and unfortunate that we had to do this. And it's a warning strike. It's just 7 days warning strike that we are embarked upon. But we hope that we will be able to call this off once our demands are met. We do not plan to leave our patients unattended to at all.
Well, we do hope that your deliberations yield positive results so you can render the needed care to the millions of Nigerians who need you at this time. Chairperson, National Association of Nigerian Nurses and Midwives, UCH Ibadan, Fumilayo Famino, thank you very much for talking to us on TVC Media News.